Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic, what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis, and it's the leading cause of disability in America. Interestingly, more women than men suffer from arthritis by 20%, and the total cost for arthritis treatment in the U.S. exceeds $100 billion a year. Between 2000 and 2010, the number of knee replacements in the U.S. doubled. I can tell you right now the population didn't double in that decade. It's just the popularity of the procedure has gone nuts. Almost 600,000 knee replacements are performed every year. By 2030, that demand could reach 3.5 million a year. 35% of those with a knee replacement are between 50 and 69 years old. So knee replacement is elective. It should only be performed after considerable conservative treatment because although it is a highly successful procedure, there are some considerable complications that can occur, and the implants are not meant to last forever. So first-line treatment should consist of anti-inflammatories and Tylenol. For exacerbation periods, then prescription pain medications such as narcotics can be prescribed. Topical prescription pain creams have been a great addition to the treatment armamentarium. Physical therapy can be great because it can help with strengthening up muscles around the knee, which can take pressure off the knee and hence reduce pain, and then bracing. The various types of knee injections on the market today include cortisone injections, also called steroid, hyaluronic acid, which is also known as Synvisc or Hyalgan as its brand name, and then the newest, latest, and greatest are the regenerative medicine injections, which include platelet-rich plasma therapy and then stem cells derived from either bone marrow, fat, or amniotic derived. So cortisone injections have been done since the 1950s. They've been a mainstay of knee arthritis treatment. Initially they were done for rheumatoid arthritis, but then it spanned over into osteoarthritis. They don't cure anything, and it's also questionable if they harm cartilage. This has never actually been proven. It was only shown in small animals, never in large animals and not in humans. Studies show 75% good to excellent results for joint injection with pain relief, and this may last for months at a time, and those injections can be repeated. They truly are the gold standard for knee arthritis. There's not one specific type of cortisone that's universally used. There's various such as Kenalog or methylprednisolone or betamethasone. Hyaluronic acid injections involve, like I said, Synvisc or Hyalgan or other brand names. It's the motor oil that's normally found in synovial fluid of joints. In 1997, the FDA approved the first hyaluronic acid preparation. It's made from rooster combs, okay, so it's not human hyaluronic acid, but it's biocompatible. Neither product has shown superiority between the ones available. One of the largest studies in the U.S. showed beneficial effects in 80% of patients for over 6 months. And the theory is that it provides lubrication, anti-inflammation, and maybe compels more cartilage to be formed. PRP therapy stands for platelet-rich plasma therapy, and it involves a simple blood draw from the arm, which then, of about 30 to 60 cc's, this then gets put into a centrifuge which spins it rapidly for about 15 minutes, and then it produces 3 layers. The middle layer has a lot of concentrated growth factors and platelets. That's what gets used, maybe 5 to 10 cc's out of the 60. So it involves 1 to maybe 3 injections into a painful knee. Multiple studies are showing significant pain relief from the procedure. There's one at a hospital for special surgery that showed 70% good to excellent results at 6 months from just 1 injection, and it also showed preservation of cartilage in over 70% at 1 year looking at serial MRIs. That's impressive. Looking at stem cell injections, these actually, along with PRP, it has the potential to alter the course of arthritis and not just to mask pain. They fall under the realm of regenerative medicine, so the idea is to repair, regenerate, restore tissue that's been damaged, such as cartilage. One of the most common types of stem cell injections are bone marrow derived. These come from your iliac crest, where the bone marrow is taken, it's immediately processed and then injected into the knee. Fat-derived stem cell injections are good, they're just less popular because the procedure takes about 2 hours. Amniotic-derived stem cell injections are rapidly coming into popularity. They are from amniotic fluid, which has a tremendous amount of stem cells. It's processed at an FDA-regulated lab and then cryogenically frozen and then thawed for injection. It does not produce a host versus graft reaction. It's working extremely well for knee osteoarthritis, and it's been very impressive so far. Looking at the results in knee cartilage defects, 6 months after transplantation, the patient's clinical symptoms had improved and improvements have been maintained over the follow-up period. This was for bone marrow derived. There are no large clinical studies in humans to prove effectiveness, but there are a lot of small studies. The bottom line is that there are various types of knee injections available. All are low risk and outpatient. In combination with other treatments, they may help delay or avoid the need for knee replacement. All can be repeated every 3 to 6 months as necessary. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at NewJerseyPainNetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.